We go now to Laura Windsor, who has a report on prenatal diseases that can put mother and baby at risk.
Prenatal care is essential during your pregnancy, especially if you've been exposed to sexually transmitted diseases and childhood diseases you may not have been immunized against. We spoke to Dr. MeeRa Chong of Redlands Community Hospital in Redlands to find out the risks involved in some of these diseases.
Prenatal care is very important. Sometimes we only see the women when they're pregnant, but we also like to emphasize preconceptual care. So even before you decide to get pregnant, there are things like starting on a prenatal vitamin or looking at health issues or your family tree that can help us optimize your pregnancy. And once you come into our office and establish prenatal care, there's a variety of blood tests and risk factors that we look for. Certain medical conditions can be or can affect the pregnancy, and we need to get those under good control to make sure that the mom and baby have a safe pregnancy.
What happens if you weren't immunized against childhood diseases?
Well, there are many viruses that can affect pregnancy, and fortunately most adults are already exposed to these viruses during childhood, so they don't really affect the pregnancy. Or you might want to say that the illnesses don't have a real impact on the pregnancy once you've had that first infection. Things like chickenpox is caused by the varicella virus, and again, most people have been exposed to this during their childhood, so it doesn't, or it rarely causes a concern during pregnancy, since most people are going to have had it already. And immunity is lifelong, which means it will be protective during pregnancy and protective for the fetus. If you are exposed for the first time, however, it can cause birth defects in the child, and we would ask you not to visit the office to prevent exposure to other patients.
We asked Dr. Chong what can be done during a woman's pregnancy to prevent exposing her baby to sexually transmitted diseases.
Women can use condoms and practice monogamy. That will limit their chances of being infected with chlamydia or gonorrhea, but there are antibiotics that can treat the infection. Another venereal disease that pregnant women are concerned about is genital herpes. And this is a sexually transmitted disease without a cure, but there are treatments that are available. The most concerning thing about herpes is when you have an outbreak, an active outbreak during labor, because this virus can be transmitted to the baby. And if this is the case, then a C-section delivery would be recommended. At the same time, you may not have an outbreak, but you can have no lesions and still shed the virus, and so there are medications that are available to reduce transmission to the baby for these reasons. The one thing I want to get across is that many viruses can cause problems in pregnancy, but oftentimes patients have been exposed previously, which provides them protection during the pregnancy, and so they don't really present a real threat once you've been immune and exposed outside of pregnancy.
If you plan on becoming pregnant, or you already are, prenatal care during your pregnancy ensures a happy outcome for both you and your baby. I'm Laura Windsor for the American Health Journal.